topic also, this is a very old topic. Okay, so this is just a revision class. Okay, so I will send this PowerPoint in the group, and after the class, please check each and every slide, and you can make notes from this PowerPoint also. Okay, so today's class is basically on de-addiction. Okay, what are the medicines or what are the agents we can give in for de-addiction or for detoxifying. Okay, so first of all, let us see what are the drugs. Okay, so many patients, okay, individuals, especially teenagers. Okay, so when because of peer pressure, because of friends' pressure, or so they get to indulge in drugs. Okay, so if they are in depression or whenever they are in stress, so they take alcohol, they smoke cigarette which contains nicotine, they take tobacco chewing, okay, and they take many other drugs also. So what are the drugs of our abuse? They are basically alcohol, okay, nicotine and tobacco. Then depressants like barbiturates, benzodiazepines, medicines, stimulants like amphetamines and cocaine. Then marijuana, opioids like morphine, heroin, methadone. These are all opioids. And last is the psychedelics, that is the LSD, the mescaline, and the ecstasy. Okay, so basically these are the drugs uh, where if an individual takes uh, first dose, second dose, what happens is they get addicted. ठीक है, addiction हो जाती है. So so we have to give health education about how we can stop using these drugs. Okay, these are basically the illegal drugs. Now coming to the symptoms of addiction. So once a patient becomes very addicted to alcohol, or patient becomes very addicted to marijuana, yeah, cocaine, yeah, heroin, so patient will have some symptoms. Even alcohol also, even tobacco smoking. Okay, so if they get addicted to these drugs, then they will show some signs and symptoms in their body. Okay, so the signs and symptoms of addiction are: number one, patient will have loss of interest in their daily activity. Okay, so their daily life also will be affected. Okay, so they are not able to go for their work, they are not able to do any exercise, they are not able to take care of their family, they are not able to take care of their home, not able to cook food. So there is loss of interest in their daily routine. Then second, there can be loss of appetite. There can be loss of appetite and loss of weight. Okay, so loss of appetite and loss of weight also is mostly seen, especially in patients taking alcohol. Okay, when they are very addicted to alcohol, or when they're addicted to any drugs, their weight is lost and they do not have the appetite to to take food. Then third is unsteady gait. Okay, so the way of walking, the manner they are walking, the manner they are standing, that is abnormal. Okay, so they are not able to stand in one place. Okay, so if a patient is alcoholic, okay, patient is taking alcohol, and due to the effects of alcohol, the balance and coordination is affected. Okay, so they're not able to walk properly, they're not able to stand properly. Okay, so they are just walking in an S shape, or you know walking here. It is abnormal, the walk is abnormal, so that is unsteady gait or clumsy movement. Then for this, the eyes will become red and the vision also will become it will become blurred. Okay, so the vision is not clear, it will become blurred, and the eyes will become red in color. Then there will be numerous injection sites. Okay, patients taking injection, taking heroin, cocaine, marijuana. Okay, so they can take in injection form. Okay, so whenever they get a chance with syringe and needle, so they will, inject themselves. Okay, so there will be numerous injection sites and blood stains on their clothes. Then next sign and symptom of addiction will be the patient can have nausea, vomiting, and body pain. Okay, so patient taking alcohol, patient taking any drugs, they can have body pain, they can have nausea, they can have vomiting. Then apart from that, they can feel very drowsiness, sleepy. Okay, especially these drugs like marijuana, they make the patient very sleepy, drowsy, very tired, fatigued, lethargic, and passivity. Next, patient can have acute anxiety, they become very anxious, become very stressed, they can go into depression and profuse sweating. Okay, so they can have excessive sweating also. Then another sign and symptom can be mood swings. Okay, so once they take these drugs, they can have mood swings and they can have tantrums. Okay, so they can get angry easily, they can get very irritated easily. So these are mood swings and temper tantrums. Next, after taking these drugs, okay, it can be cocaine or it can be heroin, they can have some emotional detachment. Okay, they can have their emotions can be affected. Okay, some people they cry, or some people they show anger. Okay, so their emotions are affected, and there will be personalization. And last is impaired memory. They will not be able to remember things clearly. Okay, what happened last night, what happened yesterday, they will not be able to remember it properly. Okay, so that is impaired memory. Forgetfulness. Okay, so these are basically the sign and symptoms of addiction, or sign and symptoms when people are very addicted to the drugs. Okay, is this clear? Is there a doubt here with the sign and symptoms?
No, ma'am.
Okay. Now coming to the de-addiction. Okay, so I've taught you about the drugs that can cause the illegal drugs which can cause addiction to the person. Okay, then what are the signs and symptoms that the patient will have once they are addicted to the drugs? Okay, and now coming to the de-addiction. De-addiction का मतलब है just we are trying to stop the addiction sign and symptoms. Okay, so in de-addiction, the drug rehabilitation is a term for the process of medical and psychotherapeutic treatment for dependency on psychoactive substances like alcohol, prescription drugs, street drugs like cocaine. Okay, so here drug rehabilitation. Okay, in drug rehabilitation is it is a therapy. We can say that we are giving medical treatment to the patient. Okay, in the form of medicine, so that their addiction can be stopped. Okay, their signs and symptoms can be decreased, and also we are not only medicine we are providing, but we are giving some psychotherapy treatment. Okay, so uh, psychotherapy. Okay, there are many types of psychotherapy, so we can give psychotherapy to the patient also along with medicines. So these a combination of medicine and psychotherapy we can is called as we can call it as drug rehabilitation or de-addiction. So the general intent is to enable the patient to stop substance abuse. So the main goal of de-addiction, okay, there are many de-addiction centers in India. So the main goal of these de-addiction centers is to stop the patient from taking any of these illegal or substance abuse. Okay, so that they can avoid the psychological, legal, financial, social, and physical consequences that can be caused, especially by extreme abuse. Okay, so why? Because if patients are very addicted to these drugs, क्या हो जाते हैं उनकी जो physical health that will be affected. And as I've taught you the signs and symptoms. Okay, so their physical health will be affected. Okay, number two, psychological, the way of thinking, the mental health that will be affected. They will not be able to remember things. They will not be able to focus or concentrate on anything. Number three, it is illegal. These drugs, cocaine, heroin, marijuana, these are all illegal drugs. Okay, so once they are caught taking these illegal drugs, then they can be put into prison. Okay, then taking these illegal drugs also, because they are costly. You need money to buy these drugs. You need money to buy alcohol. You need money to buy cigarette. You need money to buy drugs, heroin, cocaine, opioids. So there can be financial loss in the patient. Okay, so patient will be losing a lot of money just because they are buying these illegal drugs. Okay, so there can be financial loss. and then social also. It can affect their society. Okay, so once the society finds out that, oh, this person is taking is taking illegal drugs, then what happens is it can affect their social life. Then and last is the physical consequences, that is the physical health. Okay, so a patient can have depression, they can go into anxiety, they can feel drowsiness, lethargy, tiredness, loss of weight, loss of appetite. Okay, mood swings, all these are affecting the physical health. Okay, so this is the main goal of de-addiction, or the main goal of drug rehabilitation, that is to stop the patient from taking any illegal drugs, or stop the patient from getting addicted uh, to these substances. Okay, and we call it as substance abuse. So is this clear with de-addiction? Is there a doubt here?
I'm clear.
Okay. So in India, there is a drug de-addiction program. Okay, so in India, the abuse of alcohol, okay, the addiction of alcohol, tobacco, and cannabis is not entirely new. So this has been followed in the previous years also. Many years ago, these things are very common in India. With the introduction of new drugs like and medical remedies, which often contain cocaine or heroin derivatives, were freely distributed without prescription. So okay, so these uh, drugs like cocaine, like heroin, they were being distributed without any doctor's prescription in the black market. Okay, so according to the Article 47 of the Constitution of India, it directs the state to regard the raising of the level of nutrition and the standard of living of its people and the improvement of public health, okay, as among its primary duties, and in particular to endeavor to bring about the prohibition of, or the compulsion of the consumption of drugs except for medicinal purpose, of intoxicating drinks and drugs which are injurious to health. Because according to the Article 47 of the Constitution of India, it says that all states should have this law that you cannot buy these drugs without any prescription from the doctor. Okay, or and also every state has its responsibility to improve the public health. Okay, improve the public health, stop inspect the black market for all these availability of these drugs. Okay, and also every pharmacy should be checked properly for selling of any illegal drugs. Okay, so this is the drug de-addiction program in India. Then the drug de-addiction program of the Ministry of Health and Family Welfare was started in 1985 to 1986. Okay, so this de-addiction program, okay, so it was started in 1985 to 86. It was modern. Again, it was revised in 1999. Okay, so these programs, they're always being revised, or they're always being updated or upgraded. Okay, so they hello, second years, can you hear?
Yes, ma'am.
Hello.
Yes, ma'am.
Okay, so I'll just continue. So the scope of this scheme, okay, so the scope of this de-addiction program, which was revised, latest revision was done in 1999. Okay, so their main goal was enlarged to include assistance to state government, union territories for developing de-addiction centers in the identified medical college and district level hospital. So the scope of this scheme, this scope of this de-addiction program, they said that there should be de-addiction centers, okay, especially in medical colleges and also some in district hospitals. like PHCs or CHCs. Okay, so there should be de-addiction centers all over India. Okay, so that those patients who are suffering from substance abuse, okay, who are having addiction to these drugs, they can be admitted into these de-addiction centers. Okay, so that was the main aim, that there should be many de-addiction centers in India, and they should provide care to those patients, okay, so that they will stop taking illegal drugs. Okay, so this was the drug de-addiction program in India. Now coming to the most common opioids abused. Okay, so in under opioids, what are the drugs which are very commonly used? Okay, so the under the opioids, there are many drugs. That is the heroin, which is very common. Then morphine also. Okay, morphine we are using in morphine we are basically using like a anesthetic drug also. Okay, in medical term. So morphine is also a substance abuse drug. Then codeine, oxycodone, and meperidine. Okay, so heroin, morphine, codeine, oxycodone, and meperidine. These are nothing but opioid drugs. Okay, and patients who are addicted to these drugs, either to heroin or addicted to morphine or addicted to codeine or meperidine. Okay, so we have to give treatment in the addiction centers. When they are admitted, then they give some medicines. Okay, so the treatment of toxicity or overdose are opioid antagonists. We can give injection IV naloxone 2 mg, which is followed by repeat injection in 5-10 minutes, and this causes the reversal of overdose. But since naloxone has a short half-life, okay, so repeated dose is very important, and that we can give every 1 to 2 hours. Okay, so patients suffering from opioid substance abuse, we should give injection naloxone. Okay, so not only in injection form, but it can come in oral form also. Okay, oral form, oral naltrexone comes in the name of naltrexone. So oral naltrexone, this is for maintenance, and also we can give injection nalmefene. Okay, so these are the three medicines that we give in patients suffering from opioid overdose or opioid substance abuse. Then treatment of dependence. Okay, so detoxification, treatment of withdrawal symptom, treatment of withdrawal syndrome. Okay, so if patient so this is for detoxification. Detoxification का मतलब है to wash out all the toxic effects, to wash out all the poisons. Okay, so to wash out all the poisons, so we will give some medicines. Okay, so substitution of long-acting opioid agonism, that is methadone. Then substitution of partial agonist. There's another category, we call it as buprenorphine. Substitution by alpha-2 agonist, clonidine or lofexidine. And last is we give a combination of NSAIDs drugs, naltrexone, benzodiazepine, and clonidine. Okay, so we can give these medicines, these four medicines, okay, this classification to detoxify or to wash out all the poisons from the poisons of opioids. Then maintenance therapy, we can give methadone injection, or we can give buprenorphine or naltrexone. Okay, so these are the maintenance therapy for opioid overdose. Then now coming to cannabinoids. Cannabinoids coming from the word cannabis. Cannabis, remember, a very common cannabis is the marijuana. Okay, so marijuana, or we call it as ganja. Okay, this or charas भी बोलते हैं. Okay, so this, it is a plant. Okay, so this plant, okay, is widely grown, especially in the forest areas, or like whether in the jungle areas. So we have to be very careful, and you have to inspect if there are any marijuana leaves, or if there is any ganja leaves which are grown in the forest or in the jungle. Okay, because patients who are taking marijuana or ganja, they can become very addicted, and they have substance abuse. Then if patients are very addicted to marijuana, then we have to give some medicines. Okay, so the tolerance and the dependence withdrawal. Tolerance develops rapidly. Withdrawal syndrome of cannabis. Okay, patient can have restlessness, irritability, agitation, insomnia, nausea, cramping. So patients who are not getting marijuana, patients who are very addicted to marijuana, but then क्या हो जाते हैं, they don't have any more money to buy the drug. They don't have money to buy ganja. They don't have, they are not able to get these drugs. So what happens is they can get some symptoms. उसको बोलते हैं withdrawal syndrome. Okay, so some symptoms will show on their body if they are not getting the drugs. Okay, so these are the signs and symptoms. Patient can become very restless. They can become very irritated. Agitation हो जाते हैं. They're showing temper. They're showing tantrums. Then a patient can have lack of sleep because they're not able to get those drugs because they are very addicted to it. Patient can have nausea, vomiting, and they can have cramps. Then the treatment of cannabis addiction. So what is the treatment for those patients who are very addicted to cannabis or who are very addicted to marijuana? So there is no specific treatment, but there is a one specific treatment, that is a CB1 receptor blocker, that is rimonabant. Okay, so we can give this medicine so that we can treat the cannabis addiction. Then coming to nicotine. So nicotine is basically, it is found in the cigarette. Okay, so cigarette smoking is also very addictive. Okay, so within the cigarette, within that the content of the cigarette, it has nicotine. So nicotine is very very dangerous to health. Patient can get very addicted to nicotine. So the treatment of nicotine addiction. Okay, how can we reduce the addiction of nicotine, or how can we decrease? How can we treat those patients who are addicted to nicotine? So number one, there can be nicotine substitution. Okay, so we can give in the form of chewing gum. Okay, so there is that nicotine chewing gum. Okay, so we can give that also, so that they will not smoke anymore, so that their smoking addiction can be decreased. Then there is a transdermal patch also, where we can just apply it on the arms or on the extremities of the patient. Then nasal spray also. Okay, there is in the form of nasal spray. All those who do not achieve peak nicotine level, but they suppress the withdrawal. So we have to, educate the patient, so that we have to inform them about the harmful effects of nicotine, the harmful effects of cigarette smoking. Okay, it can affect their lungs. Their lungs can be damaged. Patient can get lung cancer because of nicotine also. Okay, so these education also is very important. Then coming to alcohol. So alcohol abuse is very common in India. Okay, so patient, if they're not getting alcohol, okay, so they can show symptoms. Okay, so for example, a patient is taking alcohol, okay, for continuously 3-4 weeks. Okay, and after that, patient is getting very addicted to alcohol. Okay, morning, night, evening, they're just drinking alcohol. ठीक है, addiction हो जाती है इसमें, so we become abuse to alcohol. Okay, so what happens is, for example, if they do not have any more money, or if the shops are closed because of lockdown or any situation, so they are not getting alcohol. Okay, they're not able to buy alcohol because they do not have money. So what happens is, they will show the signs and symptoms will show on their body, and those signs and symptoms are called as alcohol withdrawal syndrome. So these are the signs and symptoms that they will show on their body. Number one, patient will have craving for alcohol. Okay. Then tremors, patient can have tremors. Their hands will be shaking. Patient will have excessive sweating, nausea and vomiting. Okay, then patient can have tachycardia, where their heart rate is very fast. Blood pressure can be very high, that is hypertension. Patient can undergo seizures and visual hallucination. They will see things which are not there. Okay, they will hallucinate. Okay, so visual hallucination, they will be seeing things which are not there in the in the actual in the reality there is nothing, but they are seeing things. And also they will have delirium tremens. Okay, so these are some of the signs and symptoms of the alcohol withdrawal syndrome. Then this is according to the hours. Okay, so 8 hours after 8 hours after not getting any alcohol, okay, they can have tremors, anxiety, irritability, nausea, vomiting. Then after 24 hours of not getting any alcohol, then they can show some hyperexcitability, insomnia, not getting proper sleep. Patient can have convulsion. Then 2 to 5 days after not getting alcohol, they can have tremors, they can have hallucination, disoriented to time and place. Patient can have delirium and tremors. Okay, so these are the alcohol withdrawal syndrome. Okay, is this clear?
Yes, ma'am.
Okay, so how can we treat alcohol abuse? Okay, how can we reduce? How can we help the patient from from stopping to drink alcohol, or from from the effects or the side effects of addiction. So number one is alcohol withdrawal, including delirium tremens, detoxification. So this is alcohol withdrawal detoxification, that is to detoxify, to remove all the poisonous toxins that are produced in the body because of alcohol. So number one, we can give benzodiazepine, okay, tablets or injection form. They are chlordiazepoxide or diazepam. Okay, so chlordiazepoxide, diazepam, these are basically benzodiazepine. Then others we can give like carbamazepine. Carbamazepine also we will give to detoxify the alcohol abuse. Then alcohol dependence, treatment of withdrawal. Okay, patient is showing signs of alcohol withdrawal. So uh, for that, for treatment of alcohol withdrawal, we have to detoxify. So we will give these medicines. Number two, maintenance, to prevent the relapse and maintenance of abstinence. We will give medicines like adversive drugs like dalciferum, anti-craving agents, so that they do not crave for alcohol anymore. So we will give medicines like naltrexone, acamprosate, and topiramate. Okay, so these are the three uh, medicines that we can decrease the craving of alcohol. So they are called as anti-craving agents. Okay, so these are so there are two therapies in treatment of alcohol abuse. एक है alcohol withdrawal detoxification, means to remove all the toxins or the poisonous toxins from the body because of alcohol by giving these medicines. And number two is alcohol dependence, how we can decrease their craving, and also by giving the adversive drugs, that is disulfiram. Okay, so these are the treatment of alcohol abuse. Now coming to the next is it cocaine. So I have taught you about opioids, I have taught you about cannabis, I have taught you about nicotine, alcohol. Now coming to cocaine. Okay, cocaine also is very commonly used. Okay, which are the illegal drugs which are very famous or very common in India. So it is an what is cocaine? It is an alcohol. It is an alkaloid which is found in the leaves of Erythroxylon coca. It is a local anesthetic. Anesthetic का मतलब है it provides a numbness. It provides no sensation in the body. Okay, then recreation. It is a recreational drug. Okay, it can be taken in the form of tablet orally or intranasally through this uh, by through the nose. Okay, and by smoking also. Okay, so in the form of smoking, okay, you can take cocaine by just sniffing the drug, that is intranasally, or by tablets also. Then the common form of cocaine is crack. Okay, so in the black market, it is known as crack. Okay, and it's also known as crack. It is known as rush. Okay, runs also, then crashes, and speedball. So there are various names for cocaine. Okay, so it is also known as crack or rush or runs, crashes or speedball. Okay, so if patients are becoming very addictive or they are having abuse to cocaine, then what is the treatment? Cocaine overdose. Okay, cocaine overdose. If a patient is having a cocaine overdose, in such condition, we should give IV thiopentone, IV diazepam for seizures and anxiety, then IV propranolol for sympathomimetic effects. Then in chronic cases, we can give injection bromocriptine, which is a dopaminergic agonist, and we can give amantadine, which is an anti-Parkinson drug with psychotherapy is used. Okay, so here psychotherapy is also provided and also medications in cocaine. Okay, in cocaine substance abuse, we can give these medications. Okay, so is this clear about the de-addiction? So I have explained about each and every substance, about each and every drugs and their treatment. Okay, so anybody has any doubts regarding this? किसी को doubt है?
No, ma'am.
Okay, so I want you to read through the slide. Okay, read each and every slide, and also last time I have given a PDF, or I think I have given in Word form or PDF form. Okay, so even that also you read, and also you can take notes from this slide also, from this PowerPoint also.